What is COVID-19? COVID-19 is a disease caused by a virus, which is SARS-CoV-2 to coronavirus. The most common symptoms that people experience are fever, chills, sore throat, and others. Most of the cases have spontaneously resolved, but some cases have developed various fatal complications. This including organ failure, septic shock, pulmonary edema, severe pneumonia, and acute respiratory distress syndrome that requires specialized management at intensive care units (ICU). Individuals who are at risk for malnutrition had a more serious COVID-19 clinical course. Some persons will experience post-COVID conditions, often known as long COVID, including those with little or no symptoms. A sufficient and balanced diet is a significant element to prevent COVID-19 infections and create natural immunity. The COVID-19 patient should get education on appropriate food hygiene and eating behaviors that impact the signs and symptoms, which is xerostomia, anosmia, ageusia, nausea, and diarrhea. Pathophysiology of COVID-19. Coronavirus must infect living cells in order to reproduce. SARS-CoV-2 primarily enters the body through inhalation of respiratory droplets containing the virus. When SARS-CoV-2 initially infects people, the viral spike S protein binds to the angiotensin-converting enzyme 2-ACE2 receptor, which mediates the entry of SARS-CoV-2 into host cells such as nasal, bronchial epithelial cells, and pneumocytes. The binding affinity of the S protein of SARS-CoV-2 with ACE2 is 10 to 20-fold higher than SARS-CoV, potentially explaining the quick spread of this pandemic. Type 2 transmembrane serine protease TPRCS2, a cellular protease that is mostly found in alveolar epithelial type 2 cells, further primes the S protein to facilitate coronavirus entrance and viral uptake. Generally, the ACE2 receptor is expressed in multiple tissue cells, including airways, cornea, esophagus, ileum, colon, liver, gallbladder, heart, kidney, and testis. The range of TMPRSS2 expression is significantly wider, suggesting that ACE2 rather than TMPRSS2 may be an important and limiting factor for viral entry during the early stages of infection. Notably, drugs can be used to target ACE2 and TMPRSS2 in order to stop SARS-CoV-2 from invading host cells and spreading. Upon entry into cells in the upper respiratory tract, SARS-CoV-2 starts to replicate and propagate in the nose and upper airways. Although infected subjects may remain asymptomatic at this stage, but makes them highly infectious even if they may not show any symptoms at this point. Subsequently, the virus may migrate from the nasal epithelium to the upper respiratory tract via the ciliated cells in the conducting airways. The infected individuals can shed viral particles by not only coughing or sneezing but also during their day-to-day activities such as talking, eating, and even exhaling. The viral transmission also occurs during the symptomatic disease and may even continue after symptoms are solved. Infected individuals manifest the symptoms of fever, malaise, cough, and sputum production at the early stage. The host mounts an innate response that is mediated by cytokines and antiviral interferons and initiates the adaptive immune response. If the host is able to mount a strong interferon-mediated response at this stage, such as seen in children and adults, they may control the viral replication and limit the disease severity at this stage. Next, we will discussing about how the COVID-19 affects the body's normal function. This COVID-19 that caused by the coronavirus SARS-CoV-2 primarily targets the respiratory system but can also affect various other organs and systems. The virus replicates in the upper respiratory tract, leading to symptoms like sore throat, congestion, and loss of smell and taste. As the infection progresses, it can move into the lower respiratory tract, causing more severe symptoms, such as coughing and shortness of breath. In the lungs, the virus can cause inflammation and lead to pneumonia, where the alveoli air sacs fill with fluid which will hindering the oxygen exchange. This condition can make breathing difficult and reduce oxygen levels in the blood. In severe cases, extensive lung inflammation can lead to acute respiratory distress syndrome, a life-threatening condition characterized by fluid leakage into the lungs, which making breathing extremely difficult and requiring mechanical ventilation. Second is immune response, where COVID-19 can trigger an overreaction of the immune system known as a cytokine storm. In this phase, neutrophils, CD4 helper T cells, and CD8 cytotoxic T cells are sequestered in the lung tissue. The host cells undergo persistent apoptosis, necrosis, or pyroptosis, which may amplify the tissue damage and contribute to organ failure. Next, the immune system overload. When the immune system launches an intense response, it can trigger widespread inflammation and damage beyond the lungs, affecting multiple organs such as heart, kidneys, liver, and various organs and systems throughout the body. Next, we'll be discussing medical nutrition therapy for SARS-COVID-19 in non-critical settings, focusing on supporting the immune system, managing symptoms, and preventing complications through appropriate nutritional strategies. First, screening and assessment of malnutrition. Identifying malnutrition early is crucial for tailoring individualized nutrition plans and monitoring progress. Secondly, to support immune function and prevent muscle loss, it's essential to provide adequate energy and protein based on the patient's age, sex, weight, height, and activity level. This individualized approach helps in maintaining muscle mass and overall health during recovery. Promoting small, frequent meals can help manage appetite and ensure consistent nutrient intake. This is particularly important for patients who may experience reduced appetite or fatigue during their recovery from COVID-19. Lastly, we need to modify diets for individuals with comorbidities like diabetes mellitus or cardiovascular disease. For example, we might adjust carbohydrate intake for diabetic patients or reduce sodium for those with cardiovascular issues, which help in managing their underlying conditions while supporting recovery from COVID-19. Next, dietary recommendation and modification. Here are the dietary recommendations for non-critical ill COVID-19 patients. Proper nutrition and hydration are vital. People who eat a well-balanced diet tend to be healthier with stronger immune systems. Here are the dietary recommendations and modification. Firstly, eat fresh and unprocessed foods. Eat fruits, vegetables, legumes, and nuts such as lentils and beans. Whole grains such as oats, wheat, brown rice, or starchy tubers or roots such as potato, yam, or taro, and foods from animal sources such as meat, fish, eggs, and milk. For daily, it is recommended to take 4 servings of fruits, 5 servings of vegetables, 180 grams of grains, and 160 grams of meat and beans. Red meat can be eaten 1 to 2 times per week, and poultry 2 to 3 times per week. For snacks, choose raw vegetables and fresh fruits, rather than foods that are high in sugar, fat, or salt. Do not overcook the vegetables and fruit, as this can lead to the loss of vitamins. Secondly, drink enough water. Drink 8 to 10 cups of water every day. We can also consume fruits or vegetables that contain water, for example, lemon juice, but be careful to avoid sweetened fruit juice or carbonate drinks. Next, eat moderate amounts of fat and oil. Consume unsaturated fat that can be found in fish, avocado, nuts, and olive oil, rather than saturated fat found in fatty meat, butter, coconut oil, and cheese. Choose white meat, which is poultry and fish, that are generally low in fat, rather than red meat. Avoid processed meat because they are high in fat and salt. Lastly, eat less salt and sugar. When cooking and preparing food, limit the amount of salt and high-sodium condiments such as soy sauce and fish sauce. Avoid foods such as snacks that are high in salt and sugar contents, and also limit intake of soft drink or soda. Choose fresh fruits instead of sweet snacks. COVID-19 is a disease characterized by an inflammatory syndrome, leading to reduced food intake and increased muscle catabolism. Therefore, patients with COVID-19 are at high risk of malnutrition, which makes prevention of malnutrition and nutritional management key aspects of care. For the nutritional assessment, we use various tools like NRS 2002, MUST, Mini Nutritional Assessment, Subjective Global Assessment, and Nutrix Score to identify malnutrition risk. Anthropometric measurements including weight, height, and BMI, as well as laboratory tests like blood tests for markers such as albumin and vitamin D help to identify deficiencies. Current disease, physical examination, and dietary assessments, such as food frequency questionnaires and 24-hour recalls or food diaries, provides insight into typical intake and barriers to proper nutrition. For nutrition intervention, we can provide a protein supply above 1 kg per kilogram body weight to prevent malnutrition, hospital readmission, and complication. The proportion of lipid and carbohydrates should be 30 to 70. For patients without respiratory failure, conduct a thorough nutrition assessment to identify individual need and risks. Adjust diet based on patient's nutritional requirement, preferences, and considerations. If necessary, provide enteral nutrition or parenteral nutrition to ensure adequate nutrient intake.